So tell us why are you here? What do you see on the face? Just after we're going to be doing that, then I'm going to do marking on the face, and then we're going to be talking about the recommendations. So take a look and tell us what happened to you or what you have been seeing.
So what bothers me is it's this area here and this area here. And the whole reason why is because I've been bikini competition since 2016. So my skin's been up and down in body fat percentage. So that means the collagen is going up and down most of the time. So that's why it bothers me.
It bothers you. I'm going to do a marking, put my cosmetic lines, and then we'll identify, show it to you, and then we'll talk about the recommendations of what we're going to be doing. So right here you have lost volume, what we call the pretemporal area. Let me do some of my lines right here. This is the lower periodontal area. This one here. It's very important, in my opinion, to do proper marking on the face before injecting any filler. Actually, anytime even if I inject fillers, regular fillers, I always do a proper marking on the face. Why? Because I want to put the filler strategically on the face. Because what is happening right now is that you see patients with volume on the face, on the cheeks, and they look like they are swollen, okay? So actually when I use fillers, I use a very, very minimal amount, and I use a microcannula technique or French microcannula technique. It's very important because I don't want my patient to look like this. And the reason that's been done is because they are using the fillers in order to provide the lifting effect. So in your case, you got a very nice bone structure, okay? You have lost a little bit of volume, but I would say that trying to do this would be the best approach instead of trying to give a volume here, okay? So we're going to continue with the markings. We got a little bit of the marionette line. I would say also defining the jawline. This is another of my lines here, here, here. Okay. So like I said before, probably in your case, I'm going to be using the Sculptra, which is this product. Okay. Basically, what it's going to do, bottom line, is going to stimulate your own collagen. So what happens? The skin becomes firm. Right? And when it becomes firm, what happens causes like a lifting effect. Make this skin firm here, you're going to lift instead of providing the volume here. That's actually what that has been done for years. They provide volume and then lift. But in the process, you end up with a big extra volume, and you lose the beauty and the anatomy.
Yeah.
Exactly, that's right.
The
Yes.
chipmunk
The
effect.
chipmunk effect. Exactly. So what is happening to you really is, what we talk is the repositioning of the fat actually. So everything starts coming down. So I would say Sculptra would be a good approach because I'll be able to treat everything at once. Okay. You are going to need 3 treatments. Okay. And I will combine that one with the PRP, the blood, what people call plasma fillers, especially in this area. Right here, plasma. Here I don't like to put a Sculptra in that area, okay? But the rest, we can put it here, 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 in the whole face. After this procedure, very, very important, okay? So I call it the rule of 5, meaning that you have to massage the face on the areas that we injected 5 times a day for 5 days. The reason is because we don't want the product to clog, okay? And sometimes come from like a little nodules that usually they disappear. Okay, so it's very important that you do that. So the way just take like a gel. In this case, we're going to use arnica. Okay, for example, we apply here, right? And you just basically disperse something like this, like a back and forward. Yes. And you might feel like a little bit of something there. Remember that the product is mixed with water, right? So you might feel like you look a little bit swollen. It's not swollen. You did very well. You didn't even bleed, nothing. So it's the water, right, that you're going to see the first 2 days, 3 days. Most of the patients within max 3 days, they will reabsorb the water. Okay, so massage is the most important thing. So if you notice swelling tomorrow, right, it's due to the water per se. Okay. So you feel like a sausage. That's the product. And then you want to massage back and forward like this. So you can do circular movements. I like this because in that way you move back and forward. Also we inject it here on the nasal areas. Okay. Use always a gel. That way you don't cause friction on the skin.
Okay.
So remember, this is treatment number 1. Some people see improvement, within 6 weeks. But in your case, like we discussed during the consult, I'm recommending 3 treatments, spaced out every 4-6 weeks. And also we are going to be doing the PRP in between because of the combination of PRP and the Sculptra. It's actually a very nice combination because I want to treat also under the eyes, and that best one will be the PRP in that area. And also we put the PRP in the rest of the area that we injected the Sculptra. So remember, like this, massage in the jawline, right here. So what you're going to start noticing, like probably 6 weeks or so, like a skin firm in a natural way. You're not going to see volume like these people from Hollywood. They look totally disproportionate. But so that's the reason I like the Sculptra and the PRP combined. Nano-fat is also very good too. The nano-fat that contains regenerative cells, including stem cells from your own fat. So these treatments are for people that really are looking into the future. The stimulation of the collagen with the Sculptra, PRP makes the skin better, pigmentation gets better. Nano-fat also is amazing results also, but again, it's not to give volume, okay, to the face. I think that concept is actually, now I got a lot of patients coming in, they want their filler removed. They come and then they want to do this type of therapy like a nano-fat, PRP, the Sculptra, in which they can keep their own features. The bone structure is kept. You just make the skin firm. In that way, the patient looks lifted, but in a natural way. Also, you apply ice. Don't do any exercise.
Okay.
I like to say 5 days. I know that you exercise a lot. This is a torture for you. It depends, everybody. My rule is 5 days for exercise. Everything 5.
Okay.
5 days for exercise, 5 times a day massage for 5 days. That way you remember.